So it's now been 4 months since I had my gum surgery. I'm just on my way to an appointment now. It's been a little while since I had my last appointment. I think it was about 6 weeks ago or so, possibly even longer. Either way, they've kind of left me to do my own thing for the last little while, which has been fine. I haven't had any problems. It's not been hurting. They left me a fairly in-depth cleaning process that I needed to follow every day, and I've been doing that, so hopefully they're going to give me some good news today. At my last appointment, they were not able to tell me if the surgery had actually worked or not, so hopefully today they'll tell me and it will have worked. I think it has worked because when I look at it in the mirror, the gum line definitely looks higher than it was before the surgery. And I'm also getting my teeth cleaned today because the whole area needs to be kept clean so that the gum can kind of grow up to where it's meant to be. Because if it's not kept clean, then it gets infected and then it eats away at the gum and it just all starts all over again. So all of my checkups since the surgery have been free, or not free, but they were included in the cost of the surgery. Today's one is not free because I'm getting a clean, so I'm paying, I think they said they were charging me half price. I'm not paying the full price, but I am still having to pay for this appointment. But that's okay, as long as everything's going fine, I don't really mind too much. Anyway, I'll see you again after the appointment and I'll let you know what they said. So unfortunately they said there was still a lot of plaque around the area of my gum graft, so they weren't able to tell me still if it's worked or not. But they did set my next appointment for 3 months from now, so they can't be too worried about it, because if they were like really worried, they would have made the next appointment way earlier. And they told me that I need to be flossing every day, and I'm like, yeah, I'm doing that already. So I don't really know. They have given me another little bag of goodies. They always give me a bag of goodies. So in here, I've got some floss. Cool. These things, you like chew up one of the tablets and swirl it around in your mouth, and it like clings to any plaque in your mouth, so it makes it really easy to see where you need to be cleaning more. So last time they gave me this, they said to use 1 a week, just to check that you're doing everything right and just to like show you which bits need more cleaning. A new one of these things, so this is just for like around the gum line. A new thing of Curacept gel, so this is just like a squeezy tube. So I've had this before as well, and this is just to go directly on the graft site. So they actually said this time to put it onto the tip of this and use this to massage it into the graft site, whereas last time I think they said to apply it with my fingers, so that's a little bit different. And then they also gave me a new super soft toothbrush. Nothing special about this, it's just like, I think it's softer than the things you can buy at the supermarket, I'm not sure. They also recommended me a special toothbrush. They didn't have any, they said they're super expensive. You can get them from like, I don't know, places where you buy fancy toothbrushes. They said it was the Philips Air Sonic, I think it was called. It was either Air Sonic or Sonic Air. And they said the brand that they would recommend the highest is the Philips one. But they also said they think it's like $200 or $300. So they're going to see if they can get it in cheaper for me, which would be awesome, because if it's really going to help keep my gums clean, then I would rather buy that than have another surgery. But at the same time, like $200 or $300 for a toothbrush is a lot of money. Anyway, my teeth are all nice and clean now. I just need to try and use all of the stuff that they've given me for the next 3 months. Hopefully do a little bit of a better job than the last 3 months. I've been doing my best, okay? Like, I've been doing everything every night. What I haven't been doing is doing anything really in the morning, so that's probably what's letting me down. I need to be like brushing and flossing twice a day, and I'm only doing it once a day. So I need to step up my game, and hopefully I'll be able to get away without having to have another surgery. The guy did say if I had another surgery, it would not be the same one. It would be a tunneling graft. I haven't looked into this, so I don't know exactly what it is, but the dentist lady who was doing my clean said that it's like when, instead of taking gum from the roof of your mouth, they just kind of take it from around the area. So I will see you again later with another update. Alright, it has been a really long time since I actually filmed my previous update. Just to give you a little bit of a time frame, I had my gum graft surgery in June 2017, so June last year, a year ago from now. And my last update that you've just seen was filmed 4 months after that, so around October or November. It is now June 2018, so it has been a full year since I had the surgery and 8 months since the previous clip that you just saw. The reason I haven't updated is a couple of reasons actually. Firstly, because not a lot was changing, so there was not a lot to update you on, but secondly because in my last appointment I had been told that I was most likely going to need another surgery. No, sorry, not another surgery, another procedure. It wasn't a surgery, it wasn't the same procedure, it was like a slightly more minor procedure, but it was still something else that I was most likely going to have done, and I was just feeling really down about that. I didn't want to have it done again. Kind of in a way I didn't want to admit that I hadn't kept it clean enough for it to heal properly, but mostly it was just that I was so disappointed that I had to have it done again. So that is why it has been 8 months since I spoke to you guys, but I do have a bit of an update now, and I'm just gonna say I think that the gum graft worked. By the way, if you haven't seen my previous 2 videos, I recommend you check those out first. The first one was from the first 2 weeks after my surgery, and it goes through all of the things that I could eat each day and like the pain level kind of. So that one's like very in-depth, the first few days, a couple weeks after my surgery. And then my second video is from that point, so 2 weeks after surgery until I think it was about 2 months after surgery. So my first couple of appointments where they told me how I needed to be keeping it clean, things like that. So if you're watching this video without watching those 2 first, it probably won't make a lot of sense. They'll both be listed in the description box down below, so you can just open that and click on those. But what I am going to do now is show you what the gum site looks like a year after surgery. So it was on this tooth here, the middle left. Does it look like the left to you? It will look like middle right to you, but it's middle left for me. So as you can hopefully see, the gum is a little bit lower on this tooth, but it's not very low. It is definitely close to being at the same level as the gum on my other teeth. Before I had the surgery, the gum was basically as far down as it could possibly get. It was about to expose the nerves. It was so far below the level of my gum on my other teeth. So to me, what it looks like now is a success. It's telling me that the surgery worked and that I'm not going to need to have another procedure done at this stage anyway. Probably within my lifetime, I may need to have it done again, you know, in 20 or 30 years, but at the moment, I am counting this as a successful surgery. And I do want to let you know, in case you are getting this done soon or you've had it done already, I only noticed that my gum had come up in the last few days, and it's been a year since my surgery. Since my last appointment, which was 8 months ago, until a few days ago, I believed that my surgery had not worked. So for 8 months, I was down about it, I was disappointed, I thought I'd have to have it done again. And then finally, just a few days ago, I noticed how far the level of my gum had improved, and now I just feel so relieved. And the reason I wanted to tell you guys this is that if your gum level hasn't come back to where it's meant to be after a few months, like it won't necessarily come up after a few months. I was checking it like every month or so and it didn't look any different until literally just now. So the next thing I want to say is that when I went to that appointment 8 months ago, which you just saw, they told me I was meant to come back 3 months later, which I remember it was meant to be in January, because they were closed all of December, so it should have been December, but because they were closed, it was going to be rolled over to January. I ended up just not going. I never went in January. They gave me a call when they were ready to see me, and I missed it, and I just never called them back. I never went to that appointment, and I haven't seen them at all this year, so I haven't been back to my periodontist since 8 months ago in that last clip that you saw, which is very bad of me, bad Bronwyn, but actually my gum has come back to where it's meant to be on its own without me having to go back to them. The reason I stopped going to appointments was because they were charging me to have my teeth cleaned every time I went. So I had one clean was half price, and then they charged me full price for the next one, and they were going to continue charging me full price. And a full price clean for a periodontist, or at least for the periodontist that I was going to, was about twice the price of a dentist clean, and dentist cleans are already expensive, so you can just imagine how much I was paying and how much I didn't want to be paying it. And this was after they told me that my follow-up appointments would be free or included in the price of my surgery, so I wasn't meant to be paying. I understand that the cleans were not included, but there came a point where I started doubting that I actually needed the cleans, and I started wondering if they were just trying to make more money off me. And they were telling me, every time they saw me, they were saying, you need to be flossing every day. Why aren't you flossing every day? And I was flossing every day. So I was not sure actually what more I could be doing. So in the end, I just made the decision that it looked like they were just wasting my money by getting me to come in more regularly and get my teeth cleaned for like $500. So in the end, I just decided I wasn't going to go back in. I just didn't call them back, and I've been letting my gum graft heal on its own this year. And as you saw, it has healed on its own, and the level has come back up to pretty much where it's meant to be. Like, it's still a tiny bit lower than my other teeth, but it's almost there, and I feel like it's going to continue coming up to where it's meant to be. And if I'm honest, I haven't even been that careful, and I've not been following their instructions this year. I've stopped flossing, which I know is horrible and I shouldn't have, but I'm lazy, and it's one of the things that I hate doing. So I haven't been flossing, I haven't been using their gel thing or the mouthwash. Literally all I do is brush my teeth like I used to, except I'm now using a really super soft toothbrush, the super soft one that they gave me, instead of a normal store-bought like medium bristle toothbrush. So that's all I do. I just brush my teeth, and I make sure that I very carefully brush along here. So this is the first area that I brush when I brush my teeth, so that there's no like bacteria from the other areas getting onto there. So I brush this bit first, and then I just finish off the rest of my mouth, and that is it. And by just doing that, my gum site has healed itself. So I'm not telling you guys to stop seeing your periodontist and just assume that everything will fix itself on its own. I'm not saying that at all. I'm just saying to maybe think for yourself a little bit and make your own decisions, and just be aware that they are trying to make money. And I don't know, just be careful, I guess is what I'm saying. Because if I'd continued going to see them and paying $500 to get my teeth cleaned each time, like, I would have been out $2,000 right now. But I've just been doing my own thing at home, and it's been fine. And they had told me that the procedure had most likely not worked, and I can see for myself that it has worked. Maybe they wanted the gum graft to grow up faster than it was, but to me, what I have now is success. This is what I hoped for out of the surgery. Yes, it took longer than I expected it to, but as it is now, I am happy. And even if it doesn't grow up any more than it is now, I am happy with this result. I wish I had thought to show you what my gums looked like before I had the surgery. Unfortunately, that never crossed my mind, but if I had done that, you would be able to see how much further up it has come. But I think you can see, even just from now, the gum is healthy, and there is enough gum there that my roots are not at any risk of being exposed anytime soon. Like, it looks normal, right? I think it looks fine. So I think that is all I wanted to say. If I've missed anything out, or if you have any questions, please leave them down below. Obviously, I'm not an expert, but I can only answer for my experiences. But I know I've had a lot of people on my previous 2 videos commenting, saying that they are getting a gum graft done soon and they're worried about it. But hopefully these videos put you at ease a little bit. I guess the main thing that I can say to put your mind at ease is that it wasn't that painful. Like, it really wasn't. And if you go back and watch my first video, you'll see that, and you'll see that even though I could barely talk, I was still telling you guys that it didn't hurt that much. And I only had 1 day off work. So I had the Friday off work, and that was the day that I had the gum graft done. And then, so I had the weekend to recover, and then there was a public holiday on the Monday. So I took, in total, Friday, Saturday, Sunday, and Monday. So I had 4 days that I had to recover, and then I was back at work on Tuesday. Yes, it was a struggle to speak, but like, I was able to be there. I had the energy, I felt fine. So the recovery process is it's not horrible. And if you're having this procedure done, I wish you all the best, and I'm sure that it will go fine. And that is all that I wanted to say. So thank you for watching all 3 of these videos. I'm so glad if it's helped anyone. I don't think I'm going to be doing any more updates after this. I think this is going to be the final video in this series, just because I feel like the healing process is finished. I feel like, you know, everything's done. It might grow up a little bit more, but if it doesn't, like I said, I'm happy with where it is now. So thank you once again for watching, and good luck!